Good morning, guys. Thank you for joining us for week 3 of our Sarcopenia series that Audrey and I are doing for you. I'm going to try to keep it a little shorter and sweeter today. We are talking about exercise selection and exercise recommendations. A lot of programs that you're going to see out there are generally focusing on more bodybuilding type movements, isolated type movements. Think front raises, lateral raises, bicep curls, things like that. I want to try to push you away from that mindset. I want you focusing more on larger compound movements that utilize more musculature throughout the body. You get more bang for your buck that way. We're trying to get more overall load, more combined muscle action, not just isolating certain muscle groups. So that's really what we want to focus on. Examples of that: squat, deadlift, sled push, sled pull, get-ups. Those are the types of things that we're talking about. And I'm going to link a playlist on YouTube that I put together that gives some examples of all these movements if you're not familiar with some of these. So look out for that link as well. With these movements, I want to emphasize more movement patterns, not specific movements. So think of it in the sense of a horizontal push, a horizontal pull, a vertical push, a vertical pull. An example of those, when we're talking about a specific movement, if we look at a horizontal push, a floor press or a bench press, horizontal pull, a rowing movement, a dumbbell row, a seated cable row, a vertical pull, lat pull down, pull-ups, vertical push, overhead press, landmine press, something like that. So we don't want to pigeonhole ourselves into thinking, well, we've got to do this specific movement. As long as we are covering our basis with those movement patterns, that's the important part. I want to emphasize activities that have a direct carryover to everyday life. My favorite list for that I like to work off of when I'm designing a program for someone, I like to make sure that there is some form of squat, some form of deadlift, some form of a carry, some form of a get up, some form of a lunge, and some form of a step up. All of those are directly applicable to everyday life. Think squat, getting on and off the toilet, getting in and out of chairs, getting in and out of your car, deadlift, picking things up off the ground, carrying groceries in, get-ups, getting yourself up and down off the floor, lunges and step-ups, going up and down stairs, going up and down curbs, going up and down elevated surfaces. Like, that's where you get more carryover to everyday life, not your isolated movements like hamstring curls, knee extensions, which there's nothing wrong with those. We just want to make sure we're emphasizing the right things, trying to get the most bang for our buck. Another big important thing to me is we want to make sure to get you training outside of the straightforward neutral plane. What do I mean by that? I mean train rotational movements, train lateral and sideways strength, train your strength on all fours with things like a bear crawl, and then train your anti-rotational strength. So that's essentially your trunk's ability to resist movement. So pale-off variations where we have something trying to rotate you and you're resisting that rotation. Okay, again, there's more direct carryover to how the midline functions in everyday life with those types of activities. A big example I like to use with people is shoveling snow. Well, why do people get hurt shoveling snow? Well, it's not because shoveling snow is inherently bad for you. It's because that person just went 10 months without having to shovel snow, and now all of a sudden they're shoveling snow for 30 minutes out in their driveway or longer. If we have trained that rotational pattern throughout the year, the likelihood of them getting hurt shoveling snow is much, much, much lower because their body is attuned to that rotation and that load under rotation. So we want to make sure that we're training those compound movements with those activities out of that just normal, straightforward plane that we're all used to. Another important part, especially as you age, we want to make sure we're training our balance to some degree. This is something that so many people don't spend time training. But we know through lots and lots of research that's been done, there is a very direct link between the ability to maintain balance and all-cause mortality rates. If you can't stand on one leg for 10 seconds, your risk of dying from all causes increases. So we want to make sure that within our training somewhere we are training that balance, that ability to stand on one foot. The other point that I wanted to touch on, because I see this as people age, is getting too many people get away from strength training and think, well, I'm getting heavier, I need to do more cardio for weight loss. That's flawed thinking, because if you take away your strength training, now you're also taking away your stimulus for growing more lean muscle mass. And that is one of the most important factors within our metabolism, is how much lean muscle mass we have. And Audrey will continue to touch on that with her talks. But we want to make sure that we are strength training at a level that gives us a stimulus for muscle growth. We will talk more on that within the next couple segments as I start to talk about the rating of perceived exertion and how that carries over to choosing the right resistance, the right amount of load for your strength training. That's a further deeper discussion. But the most important thing is we want to make sure that you are continuing to increase your lean muscle mass. And if we shift more towards a cardio focus that a lot of people end up doing, we aren't getting that stimulus to increase that lean muscle mass. So very, very important factor that we want to talk about when we're looking at how do I incorporate strength training and what do I incorporate with strength training into my program design. Hopefully that helps shift your thinking a little bit with what types of movements that you should be focusing on. Like I said, I will link a playlist that I put together on YouTube that has examples of all of these within that playlist if you want to get some ideas of some things that I would program for people within this realm. So other than that, any questions you guys have, please post in the comments below. And yeah, we'll go from there. And then Audrey will take over next week with her next portion of the talk. Have a good day.